I'm Dr. Cyres Mehta. I'm basically a cataract and refractive surgeon. This means I'm the guy that you come to do the robotic cataract surgery, the laser vision correction procedures like SMILE. I've been working for about 25 years now since I returned from the US. Over the course of 25 years, I must have seen 250,000 patients. I must have done over 35,000 surgeries. SMILE is a new age procedure where there is absolutely no cut, no pain, no flap, no question of using stitches, no need for any injections, there's no downtime, patient can go back to work nearly immediately. I have patients who actually go back to work the next day. In the olden days, we used to do a procedure called LASIK, where we cut a flap on the surface of the eye called the cornea. Under that flap, we applied laser and we changed the shape of the cornea. This had certain problems with it, like dryness and glare at night. And that's why smart engineers and scientists came up with a new technology called SMILE. So SMILE is basically small incision lenticule extraction. This means that the laser system does the whole procedure in the cornea in under 30 seconds without having to cut a flap. So this is like minimally invasive laser vision correction which heals in 24 hours. Imagine a ball on which you have cut a layer and thinned it out. Obviously the ball may bulge from there. So this was one of the main problems of LASIK. Because we have cut a flap on the surface of the eye, you have cut thousands of tiny corneal nerves. And as you know, on the body, anywhere if you make a cut and you cut the nerves, they take a long time to grow back. All of us who have had small cuts anywhere on the body realize that for a long time that area is numb because the corneal nerves or other nerves in the skin, etc., they don't grow back. So the eye also loses sensation for a long time. And because of this, it becomes dry. Dryness of the eye has all kinds of issues. The vision is poor, you get a gritty feeling in the eye, and many other issues. So dryness was a very big problem with LASIK. SMILE basically eliminates all the problems of LASIK. Once again, I have to tell you that we are not cutting a flap. And because we are not cutting a flap, and because we are not putting laser energy directly on the cornea, and we are doing it inside the substance of the cornea, we are not destroying thousands of corneal nerves. Because we are sparing all these corneal nerves, people have great comfort. There's no pain after the procedure at all. And in 24 hours, you can go back to work. So SMILE has been invented not just a year or two ago. It's been invented in 2012, the first system came to market, which means years before that they were working on it. I would say more than 3 million eyes have been treated by SMILE worldwide. SMILE has passed the FDA a number of years ago. This is a tried and proven technology. It's a simple procedure to perform where the machine docks onto the eye and in 30 seconds creates a lenticule or a tiny thin shape in the eye. Then through a 2mm tunnel, we just pull out that lenticule. So that's why it's called lenticule extraction, and that's the whole acronym, Small Incision Lenticule Extraction, SMILE. Of course, because this is a minimally invasive procedure, there's no question of giving an injection. The eye is numbed with eye drops in 30 seconds. The procedure takes 30 seconds more. It takes at best 20 to 30 seconds to pull out the lenticule. So your entire procedure for each eye can be over as fast as 90 seconds. So the amount of time the person has to spend under the laser for both the eyes can be as short as 3 to 4 minutes. So this is a very, very quick and reproducible procedure. The patient feels nothing, and after the procedure there's no question of having any pain because we have not really made any cut of any significance in the eye. So the person recovers very fast. I have many patients who actually go back to work the next day. They come to see me the next day, seeing perfectly, seeing 6 by 6, which means they can read the smallest line on the chart as soon as one day. In the years that we did LASIK, and I did LASIK for more than 20 years because LASIK has been around for 25 years and I've been an eye surgeon for 24 out of 25 years. All those years we did LASIK, patients had numerous restrictions after surgery. Don't put water in the eye for 7 days, don't touch the eye, don't rub the eye. And despite having all these restrictions, sometimes the flap or the layer we cut on the eye would move or shift. And this necessitated a second procedure, under the microscope, patient was uncomfortable, they were scared, they were worried. Once SMILE came on the market, all this disappeared. You can rub your eyes the next day, it makes no difference because once again, we haven't cut any layer. There's no flap, and that's why there's no danger. This is a zero risk procedure basically, and that's why so many patients are 6x6 or 20/20 the next day, because there's no real invasion of the surface which takes time to heal. Once the SMILE procedure is over, the patient can expect that within 20 to 30 minutes he should see well enough that he can actually see messages in the phone. And in the waiting room, I see patients actually messaging their friends and saying the procedure is over. I've had enterprising patients actually sometimes record part of the surgery themselves and take selfies after the procedure, because there's no pain, there's no discomfort, and the vision recovers really fast.